Good afternoon. HIV drug resistance patterns and response to dolutegravir-based regimens in Ghanaian children. So HIV drug resistance remains a challenge to achieving UNAIDS global targets for HIV control. So what is the challenge for non-nucleoside reverse transcriptase inhibitors? So it used to be the common first-line treatment. It has a low genetic barrier and which predisposes to virological failure. So the problem is children are on NNRTI-based regimen, there's resistance, and they are switched to DTG-based regimen with a prior resistance. So this results in functional monotherapy or even dual therapy. So the aim of the study was to examine the frequencies and patterns of HIV drug resistance in children living with HIV who developed virological failure while on an NNRTI-based regimen. And this was prior to the introduction of DTG in Ghana. And we also described the virological response after they had switched to DTG-based regimen. So it was a retrospective study in 20 children at the pediatric HIV clinic at Kolebu Teaching Hospital in Ghana. We did next-generation sequencing in them. We looked at the mutation and categorized them into either majority or minority mutations, and we assessed the resistance to the current medication they were on, that is the NNRTI, and even potential future options. So this is just a profile of two of our patients, and you can see before switch, all of them, in fact, 100% of them had resistance to 3TC there. Then after the switch, you realize that the 3TC, so the crossed-out medications are those which have intermediate or high predicted resistance. So you can see this first patient has dual therapy, only abacavir and DTG is working. And the second patient has only monotherapy, TDF, 3TC, they're all resistant, so only the DTG is working. So the most common NRTI mutation was M184V, as you can see, and the most common NNRTI mutation was K1039. So in terms of the virological response, only 45% of the patients achieved virological suppression whilst being on DTG, and this was after being on DTG for 50 months. So what is the resistance pathway and treatment implications? All of them had NNRTI resistance. They switched to DTG, and only 45% had virological suppression after being on DTG for 50 months. So in conclusion, there was a high rate of resistance mutation. Despite switching to DTG, only 45% of children achieved virological suppression. So further research is needed to look at children with prior NNRTI exposure and to understand the role of the resistance, particularly in contexts where DTG-based regimens have shown suboptimal outcomes. Thank you very much.